Now we start with the COVID-19 crisis that continues to grip the country.
Yes, so with social distancing measures introduced in South Korea back on Monday, unfortunately the country is expected to see yet another day with a daily figure of new infections in excess of 2,000.
Plus, on Thursday in Korea, health authorities reported a huge jump in the number of deaths, with 24 marking the highest daily figure since the fourth wave started last July, putting authorities on high alert.
Yeah, a worrying statistic indeed. Now, to bring us latest, we have our Choi Won-jong in the studio. Mr. Choi, thank you very much for joining us.
Mr. Broom, good morning.
Now, Won-jong, like I've mentioned a while ago, we saw a very concerning number of daily death tolls yesterday. But what about those severely ill? Are they also that much concerning?
Well, it's a little early to say, but it's definitely concerning at this point. Just giving you a brief update on people severely ill with the COVID-19 from Thursday, we had 365 patients who were hospitalized due to serious health complications. 13 cases less than the previous day. And we can't surely say it's increasing every day. However, according to a recent report from National Institute for Mathematical Sciences, on Friday, the number of severely ill patients could jump to 500 within 2 weeks or 800 in a month. This prediction is based on the reproduction rate of the virus from October, and it's currently at 1.3. A figure above 1 means increase in infection is expected. For this reason, some experts are saying that we need to provide booster shots for those in high-risk groups. Now, looking at the hospital bed availability across the country, as of Wednesday, there are a total of 1,111 beds for severely ill patients. 527 beds are occupied, and so 584 beds are still left if needed. But again, if there are over 800 patients next month or so, this is going to become a serious matter.
Yeah, a lot of people might say, well, why don't you just get more beds? But for seriously ill COVID patients, you need more than just your regular hospital bed. You need all the equipment that goes along with it. But what's the government saying about this issue?
Well, so far, the health authorities are currently working on the emergency plan. If daily COVID-19 cases go above 5,000 and over 75% of the hospital beds for severely ill patients are being occupied.
Then I must ask, how many cases are we expecting for today?
Well, looking at the reported cases from midnight to 9 p.m., today's figure will be around 2,400. But cases from Busan were not included in this figure. 2,038 cases were reported up until 9 p.m. on Thursday, 102 less than the previous day at the same time period. 1,675 cases are from the greater Seoul area alone.
Now let's look at the more global aspect of this pandemic. Europe has one of the highest vaccination rates out of any continent anywhere. But the WHO is warning that in many European countries are seeing a fresh resurgence.
That is right. Daily figures for the past week in Europe were reported 1.8 million cases, now 6% higher than the previous week. The death toll has also jumped by 12%. Listen to what the WHO's regional director for Europe said about this issue.
Today, every single country in Europe and Central Asia is facing a real threat of COVID-19 resurgence or already fighting it. The current pace of transmission across the 53 countries of the European region is of grave concern. COVID-19 cases are once again approaching record levels.
They added that it's due to low vaccination rate in some areas and are worrying that the death toll in Europe and Central Asia could surpass record levels.
According to one reliable projection, if we stay on this trajectory, we could see another 500,000 COVID-19 deaths in Europe and Central Asia by the 1st of February next year.
Then, Won-jong, can you tell us more about some of the countries that we're worried about? We're seeing high numbers of infections.
Of course, let's start with Germany. Now, Germany reported more than 33,000 COVID-19 cases, which was the highest daily increase since the start of the pandemic last year. And in Russia, more than 40,000 cases and a daily death toll of 189, another record. And over Greece, over 6,000 cases on Thursday reported, the highest number ever in the country.
No, it isn't all doom and gloom. There might be some light at the end of the tunnel because the United Kingdom has become the first country in the world to approve the use among certain eligible groups of the world's first antiviral COVID-19 treatment pill. Tell us more about that.
Yes, the UK became the first country in the world to approve the antiviral pill for COVID-19 developed by U.S. Pharmaceutical company Merck. The country gave the okay to use the pill on Thursday, despite the fact that the details regarding how quickly the pill would be available were unclear. The pill has been granted for use for people over 18 who tested positive for COVID-19. Now, this can reduce symptoms and speeding up recovery.
Well, we certainly hope the pill could bring us some positive changes. Thank you, Won-jong, for your report. We'll talk to you again soon.
Thank you.